Following the fire and explosion on the Deepwater Horizon on April 20th, CDC immediately activated its Emergency Response Center to coordinate response activities across the agency. CDC's National Center for Environmental Health leads the incident command and works closely with the National Institute for Occupational Safety and Health to respond to potential health threats to the public, to workers, and volunteers from the disaster. As of today, CDC has 269 staff involved in the response, including 21 staff deployed to the Gulf Coast states. Throughout this response, CDC has been coordinating our efforts with other operating divisions of the Department of Health and Human Services, with the Coast Guard, with OSHA, with EPA, and state and local health departments in the Gulf states. As a part of the overall response, NIOSH has undertaken 3 activities. First, NIOSH is rostering workers involved in the response by means of a voluntary questionnaire. This roster will serve as an accurate record of individuals involved in the response, which will be vital for possible future studies to determine whether health conditions that may develop in the future are associated with occupational exposures during the cleanup. To date, NIOSH has rostered more than 14,000 workers, and we continue to work hard to include as many of the responders as possible. We are rostering workers as they complete training and at the staging areas in order to reach workers already trained. In the last week, NIOSH has also begun rostering some response workers online through a secure website. NIOSH has provided a secure link to multiple federal agencies, to BP, and to others, and has asked them to refer workers to the website to complete the roster electronically. NIOSH is also reaching out to state and local health partners to identify mechanisms to assist us in rostering all parish, local, state, and National Guard workers. Second, NIOSH is conducting health surveillance to monitor for worker symptoms, health complaints, injury and illness, or job stress by collecting data from all sources and analyzing that data to detect trends in injury and illness reports so that we can recommend interventions to prevent injuries and illnesses. NIOSH is encouraging workers to report symptoms they feel are associated with the response work to both their employers, to medical personnel, and to state and local health departments. NIOSH is also drawing on the surveillance data being collected and analyzed by our colleagues in the Centers for Disease Control. CDC is collecting data from 60 poison control centers through the Gulf region. The majority of those calls thus far have been from response workers. CDC is also collecting data through the BioSense surveillance system, which we used during the H1N1 epidemic, from 86 healthcare facilities. Many of them are community clinics funded by the Health Resources and Services Administration of HHS, from clinical labs, from hospital systems, ambulatory care centers, and from VA medical treatment facilities, pharmacy chains, et cetera, to detect any increase in respiratory or other possible oil-related health effects. CDC is also analyzing surveillance data being collected by state health departments in the Gulf to monitor for potential health effects related to the oil spill. CDC has posted results of these collaborative surveillance activities on the CDC website and updates these regularly. Third, NIOSH is conducting health hazard evaluations of reported illnesses among workers involved in onshore and offshore operations, as requested by BP on May 28th, June 18th, and most recently at 8 a.m. this morning, a comprehensive request for workers involved in all activities on water and the land. We've deployed several NIOSH staff members, including industrial hygienists and medical officers, to the Gulf to work on these evaluations. They are evaluating worker exposures to heat stress, volatile organic compounds, chemical oil dispersants, diesel exhaust from vessels, and other hazards as they're being identified. We are also administering health symptom surveys to workers involved in various onshore and offshore operations. Once the HHE is completed, NIOSH will compile the findings and recommendations in a report that will be provided to the employer to employee representatives and will be publicly available on the NIOSH CDC website. As we learn more, CDC and NIOSH will update its recommendations regularly. Thank you, Mr. Chairman, for your continued support, and I'm pleased to answer any questions you may have.